So I got charged $6,800 for a 5-hour hospital stay. I had recently gotten back from a trip to Europe in 2019. I know, pre-pandemic, we lucked out on the timing, but we stopped by New York on our way back to California to visit with some friends and explore the city. But on arriving home, I started getting some abdominal pain. And at first, I wasn't too worried about it. And, I thought it'll go away on its own, as these things normally do. But to my disappointment, it kept getting worse. And it got so bad that I was using the bathroom every hour, and the abdominal pain, just this horrible cramping and just sharp pain sensation, just became unbearable. This was probably the worst pain I'd ever experienced in my life, like 10 out of 10. I thought I might be dying or something. It was like that bad. So on day 4 of suffering, I said enough is enough. It's time to go to the doctor. Of course, I couldn't get in to see my PCP because, that's a 2-week wait at minimum. So instead, I went to Doctors on Duty, and they ended up giving me the wrong medication, Imodium. Fun fact, if you're having diarrhea, you're not supposed to stop it in many cases. Your body is trying to get whatever is causing the diarrhea out of your body. So I was then taking this medication, and I feel better at first, and then way worse, just like nosedive. And so I didn't think it could have gotten worse, but it did. I was in excruciating pain. So at 5 a.m. on a Sunday morning, I drove myself to the emergency room and got myself checked in. They did a bunch of tests, including a CT scan, to make sure there wasn't anything, crazy going on in my abdomen. Thankfully, that all came back negative. It turns out that it was a bacterial infection, likely foodborne, that had affected my GI tract. And so I got some antibiotics, and literally within 1 day of taking them, I felt like 75% better. I was very dehydrated as well, so prior to going to the hospital, so it's a good thing I went overall. So anyways, it's 2 weeks later, I'm feeling much better, and I get a letter in the mail from the hospital. I open it up, I read it, and my jaw just drops. I owe $6,800. At the time, I was self-employed and had to purchase health insurance from the marketplace. I was already paying $1,000 per month just to give me the privilege of having a $7,000 deductible and an $18,000 out-of-pocket maximum. And I had just started my business. I didn't have $6,800 at the time to cover that expense. But the thing that I really want to focus on is this. When I looked through the itemized bill from the hospital, the most expensive component was the CT scan. This charge was over $6,000, and the insurance approved all of it. If I went to any outpatient CT scan facility, that would be below $1,000 at most places. The hospital was charging 6 times the amount, and then the insurance was paying it. So not only that, but I found out that half of the doctors that I saw were called what's out of network, meaning that their services were going to cost me way more out of pocket, which they did. Now, I'm not against healthcare providers being out of network. I'm actually all for it for a variety of reasons. In fact, I build out a network for a lot of cases, but I'm not for it for emergency services to be out of network where you get a massive bill from it. For planned procedures in services where you have time to research and make a decision about who to see and how much you're going to pay, I'm totally okay with that, but not this. And the really messed up part is that this happens on a daily basis across the US. Deductibles are so high now for a majority of Americans that bills like that are commonplace. And unfortunately, $6,800 is probably on the low end for what some of you may have been charged at the hospital. There aren't any solutions presented in this video. I'll have others for that, but I just wanted to share how absurd this is. Just please share your experiences in the comments below. I want to know what crazy bills you've gotten and what you did about it. A good book on this topic, though, is Never Pay the First Bill by Marshall Allen. I hope that saves you a bunch of money. And in the future, like I said, I'll make a video about just how to pay less on these bills and what I did specifically to reduce it. But anyways, thanks for watching, and have an awesome day.